Hi, everyone, and thank you for joining us for Well Ahead Louisiana's Provider Education Network webinar series. Today, we'll be talking about motivational interviewing, helping clients make positive health changes. My name is Marcy Hubbs, and I'll be presenting today's topic. I'm the Provider Education Network Manager for Well Ahead Louisiana. I'm also a registered dietitian, certified health coach, and certified diabetes educator. I've spent much of my career counseling patients regarding weight loss and diabetes management. So with this experience, I've seen the need and the effectiveness of motivational interviewing. So I'm very happy to discuss this topic today, and I hope to share information that can help you in your daily practice. Today's learning objectives are to understand what prevents clients from making change, to understand how motivational interviewing helps elicit change, and lastly, to learn the tools for administering motivational interviewing. As healthcare providers, our purpose is to improve health and well-being for the clients we serve. To help them make healthy changes, we must understand what prevents clients from making a change. So we'll first focus on client behavior. As clinicians, we know that many times the prevention and management of chronic disease is based on a patient's changing certain behaviors. Changing dietary intake, increasing physical activity, and quitting smoking are some major behavioral changes that we know are needed to improve health and prevent disease. For me, working in the clinic setting for over 20 years, I'm familiar with what often happens. We see clients, we make the recommendations, but clients don't seem to make the changes we suggested to help improve their health. So if we know these changes are needed and the patient knows these changes are needed, why doesn't it just happen? I know that many providers end up frustrated that their patients aren't making the necessary changes to improve their health. So what are the reasons clients do not make these changes? Because when change is hard, it's not always because of non-compliance or lack of information, laziness, oppositional personality, or denial. When change is hard, it's often because of a motivational issue, which causes ambivalence, which leads to anxiety. So let's talk more about this. What is ambivalence? Very often, change is hard because individuals are stuck in an ambivalent stage. So what is this? Simply, ambivalence is wanting incompatible things at the same time. When you want one thing and at the same time want another, but having both isn't possible. An example would be if a person with high blood pressure understands that there is a need to take medication to control blood pressure, but the person does not want the risk of suffering the side effects of the medication. So the patient wants to take the blood pressure medication because they know it will help improve their blood pressure, but has the reason they don't want to take the medication because they're afraid of the side effects. It is this conflict that causes ambivalence. With ambivalence, there's uncertainty, and this is uncomfortable. This brings anxiety for the patients, which causes them to procrastinate. To healthcare providers or counselors, this may seem like resistance, but the root is the ambivalence and not being able to choose a direction to move. So how can we help this? Motivational interviewing can help elicit change. So next we'll learn about motivational interviewing and talk about tools for administering motivational interviewing. A simple definition of motivational interviewing is an effective way to talk to people about change. It is effective and it is evidence-based counseling approach. Motivational interviewing has hundreds of studies that have shown its effectiveness, and it has been used in various types of professional settings for counseling that requires behavioral change. So how does motivational interviewing work? There is a spirit or underlying characteristic of motivational interviewing that set a tone for the patient that helps them work through the ambivalence and move toward healthier behaviors. First, motivational interviewing fosters a partnership between the counselor and the client. This is a collaborative relationship so that the motivational interviewing, the counselor avoids the expert role and lets the client equally share in the decisions and the planning. Next, compassion or empathy for the patient. With motivational interviewing, the counselor is understanding and shows care for the client's circumstances, thoughts, and feelings. Acceptance is showing respect for the individual's ideas, strengths, and perspective. A big piece of motivational interviewing is accepting the client's thoughts and feelings without judgment. And lastly, motivational interviewing relies on evocation. And evocation is the concept that the best ideas come from the client, because the client does know themselves best. And once they reveal their own reasons to make or not make a change and what they feel is possible, it will put the counselor in the best place to help guide them toward change. When these characteristics are included in counseling, it provides an environment where the client feels open to talk and share. They feel supported, and that is the platform needed to begin to move toward change. This environment also increases the client's self-efficacy, or belief that they are able to accomplish and do things, increasing their motivation for change. I've spent much time in the clinical setting counseling patients, and I am guilty, but I know traditionally medical interventions have been in the form of direct questioning, persuasion, education, or really just spouting out information and advice giving. However, these strategies have been proven to have limited effectiveness in managing chronic disease and have been a source of frustration for the client and the clinician. So with motivational interviewing, the counselor's role is to figure out the what, when, and how of any change that the patient may be ready for. Here I'll discuss the core skills for helping achieve this. The acronym ORS can help us remember these core skills as we work toward implementing motivational interviewing. First, we have open-ended questions that call for more than just a yes or no answer. They encourage the client to talk about what is on his or her mind rather than talking based on the counselor's agenda. Affirmations. These are statements that focus on positive things that the counselor may notice about the client's strengths, successes, efforts, attempts, or any positive mood toward change you hear the client saying. Reflections. This is a matter of understanding what the client is saying or feeling and saying it back to them. Lastly, we have summaries, and this is a longer reflection of several client statements. So it is a type of reflection, but the counselor summarizes the points that may show contradiction. In other words, this would be a way to present the client's ambivalent feelings. So I'll give some examples of these and how to use ORS in our conversation with clients. So rather than asking the client, do you have any concerns about using insulin, where their answer could very easily be yes or no, and we really don't know how they're feeling or thinking about beginning to use insulin. Here's an example of how to use an open-ended question. If you did start, the counselor, if you did start to use insulin, how do you think it might possibly benefit you? And the client's response, I'm scared of starting insulin, but I know it will really help get my blood sugar under control. So you see here, when we give an open-ended question that is non-judgmental and framed, will frame the client's response, will be productive, and get a better idea of how they're feeling about the change. Again, affirmations are pointing out positives to the client. After hearing from the client, we can pick out any thoughts or things they've said that point toward wanting to change. An example here after listening to the client would be, from what I hear from you, I know that you're trying to make the healthiest choices for yourself. With affirmations, sincerity is key. Over-exaggerated compliments are likely to be unconvincing and damaging to the conversation. For reflections, rather than simply repeating back what was said, a more useful reflection provides a hypothesis regarding what the patient may really mean. The client says, but I can't stop smoking. All of my friends smoke. The counselor's reflection could be, quitting smoking seems nearly impossible because you spend too much time with others that smoke. So the counselor is working to help the client uncover reasons for not changing and directs the conversation to help the client see their ambivalence. Even when it is inaccurate, if done respectfully, it can lead to a productive conversation. A summary does not need to include every point of what a client has said and doesn't need to resolve contradictions. A summary is another way to present the client's ambivalent feelings and the direct conversation to help the client talk about the reason for not changing and possibly what they can do to move toward change. So we see here, the client may say, I don't think my high blood pressure is causing any problems. I feel fine, but I know my mother had a stroke because of her high blood pressure. I don't want that to happen to me. I know there is a lot to do to improve my blood pressure. I need to take my medicine and change my diet. There's so many changes to make. The counselor could summarize by saying, you feel okay, but understand that your high blood pressure could cause some serious health problems. I hear you list the things you should do to improve your blood pressure, but you may feel overwhelmed by making these changes. Do I have that right? So now that I've given some examples of how to use the ORs and some of the actual tools that you can use, we'll look at the steps that we follow as we work to guide the client toward making changes. First, engage the patient. You must connect with the client and establish mutual respect. Some simple ways to build this rapport is by calling them by name to make them feel comfortable, to welcome them, make them feel understood, and let them know that you have mutual goals. Second is focusing. Set and agree on an agenda to give the meeting or the conversation clear direction. Let the client name goals and priorities. We don't want this to be the client's, we do want this to be the client's idea and not just directed by the counselor or guided by the counselor, but really feeding on the client's goals and ideas and priorities. So the counselor will just act as the guide. Third, we want to evoke or elicit clients' own motivation for change. This is where we will really tune into open-ended questions to get the client to state what may be causing ambivalence and then guide them to think about the changes through affirmation and reflection. What we're looking to do is to generate change talk. You can generate change talk by asking questions like, why do you want to make change? How might you go about making a change? And what would be your first step for making a change? Change talk would be statements like, it would help if I, or I want, or I could, or maybe I wish. This signals that the client is thinking of making a change. So lastly, we hope to have uncovered some reasons for ambivalence and can work with the client to plan. Let the client supply information and guide to make specific plans. Making SMART goals would be a great way to lay out this plan. So I mentioned earlier that old school counseling methods aren't effective. To get us moving toward motivational interviewing and being a more effective counselor, we want to get away from the traditional ways of dealing with our clients. So what we want to avoid is assessing or just asking a bunch of questions. This is really off-putting to the client and it's also disengaging. The tone of motivational interviewing wants to create a collaborative relationship. We want to avoid telling the client what to do and how to fix. We want to ask, we want to listen. And again, to create a partnership, we want to avoid the power differential. We want to avoid acting as an authority. Take the time to hear them and accept their ideas and perspective. And lastly, labeling. So labeling the client in any way can also be off-putting. Definitely describing a client as resistant or non-compliant or difficult would be labeling, but simply things like calling them a diabetic is labeling. They are individuals with diabetes. We don't want to make them feel like we are equating them to their disability. In the healthcare field, we are working to move away from such labels that identify a client as their disease or their disability. I think that Keeping these things in mind and working to avoid these in our practice can move us toward creating an atmosphere that will open the client up to change and begin to motivate to change. So let's recap. I've shown reasons why clients may not be making the changes needed to improve their health. I've shown you the concepts of motivational interviewing and the skills and steps needed to implement. So here's a quick recap of things to focus on to help start using motivational interviewing and working with your clients. Remember, first, listen. This is one of the biggest steps you can make to work to implement motivational interviewing. Create an open atmosphere with a collaborative relationship with the patient. Next, ask questions. Evoke the client to give reasons for not changing and their own ideas of how they can make changes. Get them talking. Point out the positives. This will empower your clients. When they see that they are doing good things and heading in the right direction, they will begin to feel like they can accomplish their goals. So this, really empowers them, and it starts that motivational process. Present their reasons for not changing. Many times they don't realize what is keeping them from actually making a change. As you uncover their reasons for ambivalence or uncertainty, present it as positively as a reflection of what they have told you. And lastly, guide towards specific plan to move toward change. So help the client pin down goals and next steps that are specific with the time frame. Help keep them focused toward a goal. And again, if you can use SMART goals, that would be ideal. But just being specific as you can and keeping the clients focused is important. So thank you so much for joining me to talk about motivational interviewing. I hope I've given you some tips to help improve your patients' health outcomes by moving them toward some positive changes. So if you'd like to know more and hear more about the resources that we have available and trainings we have available, please visit www.walpen.org. Also look out for our twice monthly newsletter with updates on these trainings, resources, and other upcoming opportunities. And thank you so much for joining us today and for helping us move Louisiana's health forward.